Before we start, we're going to talk about some pretty questions. First question, what is the difference between arterial blood and venous blood? Second question, what's the factors that change the difficulty in how to stop a wound from bleeding? Third question, how long should you hold pressure onto a wound before you check it? This video is about bleeding management. People get hurt in the stupidest of ways. You never know when someone's going to cut themselves or lose a leg or two. So, what is blood, as some may ask? Good question. It's kind of like gasoline in a car. You need so much in your body for you to work. It carries nutrients and oxygen that make your vital organs function. If you don't have the necessary parts in your body, you kind of die. Some parts of our body actually don't receive blood directly. As you may think about it, the top layer of your skin, you can wipe it off, brush off hundreds of dense skin cells, and no blood comes out. It's because they don't have an active blood supply from capillaries, from arteries. So what happens is you have your heart, blood goes out in the arteries, comes back through the veins. And in between that process, between the arteries and veins, you're going to have these tiny little capillaries doing this very great oxygenation of tiny little parts in your body. Some parts that they oxygenate and provide blood to is the muscles, you talk about the skin, and just all the vital organs. So when you're thinking about when somebody's bleeding, they might be injured in a large area, like stabbed right in the heart. There's probably going to be a lot of blood there because there's a lot of blood flowing through. If they were stabbed in the spleen, perchance, there's a lot of blood stored up and getting filtered in there, so it's just going to explode blood. An artery is going to bleed bright red, a bright red blood, as opposed to a vein, which is a dark red blood. So when you see an artery and you see this bright red, you're going to be thinking, oh, this blood is getting pumped out. It's going out of the body, so to the arm, away from the heart. So it's going to have a little bit more pressure behind it as opposed to a vein, because a vein just flows back to the heart. An artery contains oxygen-rich blood. When that hemoglobin in the blood binds to that oxygen, we've got this bright red color in it with all these nutrients as well. So when the red blood cells drop their oxygen off at their target place, they're going to lose that oxygen and then come back through the veins, as opposed to the arteries, as dark red color. When it comes to demographics of injuries like this, everyone gets hurt. It's just a matter of time before we stumble and break our head open in some cement area. You're probably still going to get cut somehow. Plastic fork, prisoner shank. There are different energies that are associated with cuts and penetration injuries and so forth. There's a high, medium, and low velocity. High velocity you can think of like a rifle round. Medium energy you can think of like a handgun. Smaller caliber type of bullet, less big injury, but it's still going to do quite a bit. Low energy is going to be like a knife. Now, unlike Call of Duty, it's not going to be an insta-kill. When you stab somebody across the barrier of their skin, you have to assume that this area and all this direction has been injured by that knife. Actually insert into a cone of damage. Bullets are actually important because when somebody's bleeding from a bullet wound, sometimes it can go in and out and really not much blood at all. You still want to apply pressure on that because there could be bleeding on the inside coming out. Those are the extreme aspects when it comes to getting an injury. Other extremes are farm machinery, industrial accidents, things that happen that remove appendages, large cuts, and just pain, I guess. So, signs and symptoms. You're probably going to see bleeding, considering it's a bleeding injury. Yes. If they start having some unexplainable, decreased level of consciousness, you may want to hurry your butt up and get them to the hospital because they've lost a lot of blood. So how can you help? How can a paramedic, EMT, or just a simple bystander be able to help a person who's bleeding? First, BSI. Apply pressure with a gloved hand. Also, grab some gauze. That'll be good. Put it on there. It'll absorb some of that blood and help it clot. The goal here is to make the blood clot. The more accumulation you have blood, it's in the right spot, as opposed to letting all those fibroblasts, all those clotting mechanisms flow out. You want that to stay right there. So we're holding pressure on the wound. we've got a little gauze underneath possibly, and we're sitting there for like, I don't know, 3 minutes or 2 minutes, and like, this isn't stopping. You peel it up and it's still blowing out. Let's say it's bright red. Like, oh no, this is not good. This is not good at all. Take a triangle bandage and tie it as such onto the victim and tighten that down. Tighten that real hard down. Go ahead and make sure you can fit one finger beneath it. You don't want to get it too tight. You still want to make sure they have distal pulse. What this is going to be kind of like a tightening type of mechanism on there. That way you've just got a more circumferential type of tightening on there. You can also place that gauze pad right underneath there. That way there's more pressure on the wound. Coban. Use it. It's useful. This is like 1 inch wide. Not super suggested, but wrap it up about 2 inches type of diameter. That's what you're going for. You don't want anything too thin because you're going to start actually damaging the tissue at that one point. You want a broad type of adhesive part. So let's say it doesn't stop bleeding. You feel for a distal pulse. It's still present, but it's getting weak. Your patient's looking kind of tired, getting exhausted, and this bleeding is not under control. You're going to want a tourniquet. Now, if you don't have a tourniquet, it's been suggested that you use a triangle bandage. My suggestion, blood pressure cuff. Increase it to over their systolic, and that'll stop the bleeding. It's a nice wide type of area for a tourniquet, and it'll be nice and tight for them. You're going to want to increase the tourniquet until you can't feel a distal pulse. This is cutting off blood flow. A tourniquet in the past has been discouraged for possibly cutting off blood flow and you having to lose a limb at that point. But that just isn't true. Blood supply can return up after hours. So put the tourniquet on and get rapid transport right to the hospital if you need a tourniquet. You're going to want to give them fluid if they need a fluid bolus if they're hypotensive, as well as put them on the cardiac monitor and give them some oxygen. And also you may want to instruct the patient to get a tetanus shot because you always need your tetanus shot. So people get hurt. It happens.
Ah!
You okay?
May have cut my hand.
You did not seriously cut your hand. Are you kidding me? As I was saying, people get hurt, and quick action is important. Hannah lost the fight with a knife. The knife won. So what I did, I came in the kitchen. She was obviously bleeding from said wound. And I placed the gauze on there, and it really didn't stop it very much. Waited for about 1.5 minutes, 2 minutes, released up, and I realized it's a dark blood, but it was still bleeding pretty hard. And how did you even, never mind. What I did was I wrapped it with bandaging, and was about a few inches wide. Made sure I didn't cut off the blood flow completely. Felt for a distal pulse, still was there, and it stopped. Ta-da! Hopefully we learned our lesson. And hopefully you learned a lesson today, not so realistic as this one. There are questions for evaluations in the handout attached. Thank you guys, and thanks for a fun semester. Most of this is gonna get cut, as you probably could tell. class, for my capstone presentation, I'm going to be talking about pizza! I want to talk about pizza!